Hi, everybody. Welcome to Cox Connections. Brad Grunmeyer, Director of Public and Government Affairs for Cox, Louisiana. Thank you so much for tuning into our show. In this segment, we'll be talking about, not that it's near and dear to my heart, but my mother being someone who had fought the battle with cancer. I always love to have survivors come on the show. It's inspiring, let alone it speaks a message for those who know family member themselves who are on the journey with their current cancer journey. And those who have survived it, and more so even for myself, my mother who passed away from it, we also see that there's a way of moving forward and there's opportunities, and we have got to find a way to do something to stop cancer. And so I'm so happy today to be joined by one survivor, Ms. Carolyn Kurt, who is herself a breast cancer survivor, but also deeply involved from a volunteer perspective at the new infusion center at Touro Infirmary. And to join her, we have the Director of Psychosocial Oncology, Dr. Robert Gardner. Thank you, Robert, for coming by, sir, at Touro Infirmary, who himself, as we were talking, your mother, had cancer herself. So we've got this connection, and I greatly appreciate you both coming. Carolyn, tell me your story. I think it's just inspiring. We talked a little bit about it, but first off, great having you here. But tell everybody, our audience, a little bit about your personal journey with cancer.
Well, I had a mammogram and had a bad feeling about it. And sure enough, my bad feeling was correct. But hearing the diagnosis, hearing the word, yes, you have cancer, is stunning. It's stunning in the sense that you are stunned. You really can't think. It's like being hit over the head with a shovel. And your family doesn't think either. So you really need someone to come in and sort of help you rationalize, help you think. And that's where the Supportive Cancer Center comes in, because it offers so many services that you are going to need or would like to have. When I was going through my first treatment, I didn't have those services. The hospital that I was in was a fine hospital, but no one came up to offer me any kind of, well, here's how you cope, here's someone who's been through it. Sure. And when I had the second diagnosis, I was working at Touro as a volunteer. Oh. And the first person I talked to was Robert. I took advantage of all of the services, or most of them that there were. And now I'm working in the infusion center with people who are going through chemotherapy. And the supportive care services there are designed to help people as they're receiving their treatment. And there are a number of activities that they can be involved in while they're receiving their treatment.
And to today, how long have you been cancer-free?
Well, let's see, about a year.
That's fantastic.
Yes, it is. It was an unpleasant but not catastrophic experience, and I think it's important for cancer patients to understand and see that people recover. Yep. Not every cancer is the same. Some people recover, but that you can recover, and that your life can be pretty much like it was before. Right. And I think it's important to see people who are healthy in your life when you're recovering from cancer.
Well, it's great to have you here, Carolyn. It is wonderful. Thank you for being here. And more so, thanks for your volunteering. I know, Robert, Carolyn's passion is obviously because it's personal. It has impacted her, her family, her friends. But you see it in your position as Director of Psychosocial Oncology at Touro. You see it, and we were talking a little bit before, and this is what you do, and those who are going on this journey is a great balance in many ways.
Yeah, it really is. I mean, one of the things that we've learned through the research that's been done, the Institute of Medicine back in 2007 published a very comprehensive report on cancer care in America, and what they determined was that if you don't treat the entire person, not the patient, but the entire person, not the disease, but the person itself, then you're really missing the mark. You're not providing a good quality of care. And what Touro has committed to doing, and other facilities, not only in New Orleans, but throughout the country, they're really waking up and have woken up to providing supportive care to address the psychological, emotional, and social and financial needs that people experience when they're dealing with cancer.
Because it's not just the person, it's the family, immediate family, the extended family, so it takes everyone who was a part of this journey, whether wanted to or not, that they are a part of the journey, and I'm sure you felt that, Carolyn, yourself. And the nice part about it is Touro, as of September, has this infusion center which sounds like it's just absolutely incredible, the Harry T. Howard Infusion Center. Tell me a little bit about what people can expect. What is this bringing? How is the dynamic changed?
Well, we're now under one location.
Right.
In the past, we've actually administered chemotherapy in a couple of different locations within Touro.
Yeah.
So now that we're in one location, a dedicated space, it's state-of-the-art. The physicians are actually located in the infusion center, so they're very accessible. You'll see them walking through the infusion center and talking to their patients. This just doesn't happen in a lot of places. And from the supportive care standpoint, what we've done with the help of Carolyn and other volunteers, most are cancer
Which are the
survivors.
lifeblood. Which
yes, exactly.
You're a living, breathing example of hope. And that's what people need to see.
Yeah, they do. And I think what we've attempted to do with the volunteer program in the infusion center is to, as you say, demonstrate that sense of hope by having cancer survivors there while people are getting their chemotherapy. We have a variety of different activities that they can participate in, everything from we had a foundation donate a fairly significant amount of money to provide us iPads, which we can, each patient can have their own iPad. They can download magazines, movies, watch movies while they're getting their chemotherapy.
Fantastic.
Yeah. And keep in mind,
and you know, there's people probably, the digital divide, probably a little bit you know, intimidated by the iPad, but nonetheless, I was just looking at the activity menu that is available at the infusion center. It's just great. I mean, it's making people more relaxed, and it's a place that there are people that they inspire, that they can talk to, network with, but also there are activities that just make the experience just a little bit more comfortable and not enjoyable, but as close to enjoyable as possible.
Yeah, we try to make the experience as bearable as possible and take their mind off of what they're experiencing. You know, all the volunteers are trained in using the iPad, so they can walk patients through it, and someone who's
pretty handy with it, Carolyn?
I'm handy enough. It's not that, but some people...
But tell us, I mean, you're on the volunteer level. You know when you're working, how are the activities? How has been the infusion center been received by its clients?
I think very well. You know, some people's chemotherapy lasts for hours, 7 or 8 hours.
Sure.
And you're there, and you can sleep and you can watch television, but you really need some other way to help you pass the time.
Yes.
And I've seen patients working on the art projects with their iPads, just getting through the hours that they're going to be there. And I just feel like it's such a humane thing to do.
How has it been for you, Carolyn, to do what you're doing as a volunteer, and how has it also inspired you in your life?
Well, I'm doing it to pay back.
Yes.
I feel like my treatment was successful because of all the research that has been done, all the dollars that have been raised over the years. And I'm thanking everyone that's ever donated, every doctor that's ever studied for my success. And I want to give back in that way. Also, my experience was I really wanted to talk to people to tell me what to expect. I was terrified.
Sure.
And I didn't get that opportunity. I want to be able to give that to some patient who's starting out. Yep. Because it's so necessary. And I feel like I am just thankful for my good outcome.
And I would say, Carolyn, I'm sure there are many, and Robert, you'd agree, that you have touched Carolyn, and so did you, Robert. And I wanted everybody to know this is a part of Touro. Let's give everybody some information if you're interested. The website, www.touro.com, and of course, if you're interested in more information, 504-897-8202. And it's the Harry T. Howard Infusion Center. Fantastic there at Touro, and I can't thank you enough, Robert, Dr. Gardner, as well as you, Carolyn. Thank you very much as well.
Thank you so much.
All right, everybody, that wraps up this segment of Cox Connections. We'll see you next time. Thanks for watching.